Morning to all, and on behalf of Team Mirror Health, I welcome you all on this auspicious Yugadi Festival Day to discuss about women's health. We also want to set up this discussion with some very important acquaintances of the Mirror Health family who are none other than our delivered patients who would want to ask questions related to women's health on this day. Basically, this is the Krodi Dharma Samvatsara, and I would want to start this program with a very important shloka, which goes like this. Shatayur Vajradehaya Sarva Sampat Karayacha Sarvarishta Vinashaya Nimbakam Dalabhakshanam. This just says that, life is full of joys and sorrows alike, but it's the way you can handle it. So if you can actually change your reactions to both, if you're not very overwhelmed with your joys, and if you are empowered to handle your challenges, your life becomes very meaningful. So this is something that we chant every Yugadi, and we also take this mixture, which has a little bit of neem leaves as well as jaggery, which kind of symbolizes both the happiness and sorrows in our life. So with this, I would definitely want to make this festival very meaningful by having this important conversation with my associations. These women have been delivered by me, and they want to ask certain questions, which would probably be representative of questions from women across, several regions. So this meeting will be hosted, the recorded version will be hosted on our website, and this will be sent across to many people who've not been able to join live. So what else can we do to make our festival meaningful? Yes, we can do this. We can connect to our women and ask them to come out with their concerns. And as an obstetrician gynecologist, I would definitely take this privilege of answering their questions in the most scientific way. So I think we have Aishwarya here. So welcome, Aishwarya. All right. So we also want to kind of talk to you because the World Health Day was recently celebrated. So this was in the first week of April. So on this pretext, because we actually celebrated the World Health Day as well as Yugadi, we wanted to spend at least about 30 minutes to talk to you all about some health issues that may concern you, so that we can actually add a lot of meaning to today, because it's just not about the festival is incomplete if you're not going to take care of your health. So with this kind of an introduction, I would want to welcome Aishwarya Jagannathan, who is my, what should I say, a favorite acquaintance. I've delivered her two girls who are doing extremely well. So Harini and Harshini. Yeah, I always call her Janani. So, all right. So we have Aishwarya here today. And Aishwarya, can you just introduce yourself briefly so that we can ask? And then you can go ahead and ask me anything that you would want, from the health perspective. And please be aware that this is going to be transmitted across to our Mirror Health community. It's going to be on our website. A lot of people are going to watch this, and maybe that would add meaning to their concerns. So yes, Aishwarya.
Sure, doctor. Thank you, doctor. Happy Yugadi to all. I'm Aishwarya Jagannathan. I have been with Dr. Revati from right from my first delivery way back in 2011. So my association with her has been quite long, and it has been a very pleasant and happy journey. instead of all, in spite of all the turmoils and turbulences that we had during both the pregnancies, the outcomes have been really wonderful. So, so I cherish her bondage, actually, to say. So it's like a family that we've been together for so long, and everybody at Mirror Health are also like family to us. So it's like a second home. Today, yeah, I would like to ask doctor whether these autoimmune diseases, uh, sometimes they are detected even before conception.
Correct.
And some pop up after delivery. Like in my case, rheumatoid arthritis was diagnosed post delivery. So I would like to know if these artificial treatments like IVF or ICS, whatever, all those can create such diseases.
Okay. I think, Aishwarya, you've asked a very meaningful or a very relevant question in these days, because nowadays, this fertility issues are a big concern, and people are actually going through IVF mainly because, they're not able to conceive. What you have to understand, you're very right in saying that the autoimmune problems have actually increased, and they are, uh, you know, are being seen at a greater proportion compared to what it was before. I would say these problems existed before, but maybe they were not picked up. And also, let me tell you that uh, one thing is for sure: these autoimmune problems do not happen because of IVF or ART, but these problems can be of two kinds. One problem is, what is autoimmunity basically? Auto means self, and immunity is your defense mechanism. So generally, you have some kind of a defense mechanism which helps to kind of protect you from problems, like you might have a respiratory infection, or you might have some other kind of infection for which the body kind of reacts to that stress by producing antibodies. But in some individuals, what happens is they produce these antibodies in an exaggerated fashion. And sometimes, in spite of the trigger being absent, antibodies continue to remain in the body. And so they kind of target certain organs, like these antibodies which are generated, kind of target organs like the thyroid, or they might cause problems, in the uterus, which will prevent, pregnancy to and or carry on further. And this is kind of, this antibody attack can occur. It's a multi-organ kind of a situation. So it can attack the liver, it can attack the kidney, it can attack the blood, and it can also attack organs like the thyroid as well as the uterus and so on. That is why most of these factors are identified by doing a test called the ANA, the anti-nuclear antibody test, which kind of tells us that yes, there is an autoimmune component. And this autoimmune component, the extent as well as the severity of the disease, is assessed by first identifying whether it is a non-specific problem. Non-specific problem in the sense, it is just restricted to ANA being positive, and this individual does not have a bigger autoimmune problem. Like, for instance, SLE or systemic sclerosis. These are all bigger autoimmune problems. And this is causing that individual a challenge to conceive, because the fetus is considered to be an allograft. That means it is not something that is completely owned by the mother. It's got a little bit of the maternal component, it's got a little bit of the paternal component. The paternal component is still foreign to the body. So automatically, when conception occurs, the body is going to treat this embryo as foreign. And the moment it treats this embryo as foreign, it starts kind of producing these antibodies. So what happens, it can kind of prevent this conception from occurring, or the fetus which is implanted or the embryo which is implanted may have problems to survive, and that's how abortions occur. So what you have to understand is, if there are, we come across a lot of these individuals where the autoimmunity is not part of a bigger problem, like a systemic sclerosis or SLE. They just have problem to conceive and they have an ANA positivity. So we may have to suppress this exaggerated immunity so that the acceptance of pregnancy increases, so that the environment becomes more favorable for pregnancy to implant. All right. So what we do is, in these individuals, we give certain medications and we suppress the wrong kind of immunity and then treat them so that they conceive. All right. And they might, these kinds of autoimmune problems, that is where it is only a general problem. It's not like a systemic problem where it's involving us, it's not a bigger disease. In these individuals, what happens generally is, even after delivery, these individuals may be susceptible to certain things. They may have a tendency for allergy, they might have tendency for skin and connective tissue or joint problems, just like what you said, which will not occur in the first few years of life. It might occur only during middle age. After this person is about 35, 40, they might actually experience these problems. That is why when we deliver a person who is positive, we try to look at their inflammation, inflammatory stresses attacking the different parts of the body, and tell them to be on a constant vigil for immunomodulation. Otherwise, it might result in a systemic problem or a specific organ problem, just like what you said. So if I'm going to talk to you, yeah, I understand that you've been diagnosed rheumatoid arthritis, but if we just go back to how we treated you, we knew that there was a component, there was an ANA positive component there. All right.
Yeah.
And but you
Yeah.
did not have any diffuse autoimmune problem at that time. So
Yeah.
we treated that problem and we gave you a pregnancy, and post delivery, you started developing this. So you still had that exaggerated autoimmunity, which kind of reflected in joint problems. That means there was some kind of destruction of the joints, which is like, there are two kinds of arthritis. One is the osteoarthritis, which occurs because of age, and rheumatoid arthritis, where you are actually having this problem of autoimmunity, which is actually a big factor. So what we have to understand is, a person who is ANA positive need not be ANA positive because they've undergone treatments like IVF. We've had several patients who present to us with problems to conceive, and it may not be only because of ANA positivity, it may be because of other factors along with ANA positivity, but ANA positivity needs to be treated. And once delivered, these individuals have to be given specific advices as to how to monitor their autoimmune status. If you look at these individuals very carefully, these are individuals who present to you with problems like allergic bronchitis, or they have asthmatic tendency, or they have this urticaria, they have rashes, even before they conceived. Okay. And when you look at them, they have problems to conceive. So when we treat them, we deliver them, and then we give them a caution saying that be aware that you have an autoimmune tendency. So when there is a trigger in the body where the inflammatory stress is going to be high in any part of the body, it could be joints, it could be heart, it could be anywhere, then you might develop antibodies against self and cause this issue. So I think this is a very important question that you've actually brought about, Aishwarya, because it is so difficult to convince people after they are delivered, because for them, delivery is very important, pregnancy is very important. They listen to you when they have to get pregnant, but post-delivery, they don't really take care of their health. And what they don't understand is these problems can just worsen, and sometimes it can get so bad that it might even cost their lives. So it is very, very important that you take care of your health post delivery. Understand, see, God has given us this wonderful window as women, because pregnancy kind of gives you a window to understand that there could be certain stresses which can occur later in life. Suppose you develop hypertension and preeclampsia, It goes away after delivery, but you may be predisposed to cardiovascular problems. Suppose you develop gestational diabetes, you may develop diabetes later. Suppose you develop an autoimmune issue which is complicating it, you might have some other autoimmune. So this is kind of warning you. This the males don't have, they don't have that kind of an opportunity. So take this in the positive sense and, get yourself evaluated and talk to your obstetrician. Your obstetrician can help you to some extent. And later you may require some kind of collaborative help with an immunologist who can probably help you come out of this crisis. Is that okay?
Yes, doctor.
Yeah, and that's a
Because
very
I
interesting
had been hearing from 2 or 3 more of my friends also. So they
Yeah,
also said that post delivery they had developed this one.
correct. So I think this is something, and I think we have to make it very clear that autoimmunity does not stem out of IVF treatment. It's not because of IVF treatment. It is
No.
an inherent tendency of an individual to kind of exaggeratedly react to a particular stress. That's all I can say. That means the way you react to stress could be slightly more exaggerated than a normal individual. And that might attack certain organs of the body. That's all. So it does not really have any correlation to IVF. So thank you so much for bringing this out, Aishwarya. I think it's a very important thing that most people should understand. And unless and until they understand, they will not be able to take care of their pregnancy or will not be able to take care of their health beyond this. So we also welcome Dr. Thanks so much, Aishwarya. Just stay on. We have Dr. Lakshmi here. And Dr. Lakshmi, a happy Yugadi from Team Mirror Health. Can you just kind of show yourself, please? Can you just switch on your video, Lakshmi? Lakshmi, can you just switch on your video? Can somebody tell her to switch on the video, please? So, as part of the World Health Day, I feel we should build awareness, especially, she's there? Especially to the post-delivered women, that they have to take care of their metabolic problems, get vaccinated against cervical cancer, take care of their weight, because, as age advances, they are more prone to acquire more weight, take care of their cardiovascular problems, the bone health, all these things have to be kind of emphasized. Is Lakshmi be joining in? Okay. So we have Madhuri Jain here. Yes. So Aishwarya, in between, I think because it's a festival, people are joining at all times. Do you want to ask another question, another small question before I move to Madhuri?
Yeah, sure, doctor. I would like to know, is it possible for a person who has been having low BP earlier for a long period of time, all of a sudden post delivery the BP shoots up? Is that a possibility?
Okay, so she is going to just a minute. Yeah. Yeah. Okay, fine. So yes, Aishwarya, that's a very important question. What you asked me was if there is an individual whose BPs were low. Madhuri, can you please mute yourself? I'll call you in. I'll call you in a minute. Okay. So this question was, if somebody whose BPs were low, post-delivery, can she have hypertension? See, let me tell you something, Aishwarya. In the second trimester of pregnancy, generally in a normal person, a person who's not hypertensive, usually the BP is less. That is because in pregnancy, the blood volume increases drastically and the resistance is less. So in the second trimester, usually the BP falls. All right. So that's how you find some readings like 90, 60 and 160, which is acceptable, which kind of improves in the third trimester. If you're asking this question post-delivery, see what happens during pregnancy is if you are taken care of by a doctor, all your problems are kind of looked after, your sugars, your thyroids, everything, and you're under kind of, you are stable, your BPs are normal. Post-delivery, if the endothelial dysfunction, that means if there is some problem because of metabolic factors, that is, if your sugars have fluctuated, or if your autoimmunity has worsened, or if you've put on weight, all these can further increase endothelial dysfunction and you may develop hypertension. So it has nothing to do with your pregnancy per se. It just tells you that you have to take care of your overall health in terms of your metabolic and other factors, that is lifestyle factors. So if you can control your sugars, if you can control your thyroids, if you can control your weight, your BP will also come down. But at some point of time, you may require some medications because there can be some irreversible damage which has already occurred. And this irreversible damage cannot be completely reversed. So you may require medication, but further progression can just be halted by actually following the right diet and exercising and things like that.
No, thank you.
Okay, Lakshmi, are you there? Can you unmute yourself? I know you have a problem with the internet. You can just speak. Can you unmute yourself and talk, please? Is Madhuri Jain there? Lakshmi, can you unmute yourself and talk, please?
Hello, ma'am.
Thank you so much for joining, Lakshmi, and a happy Ugadi from Team Mirror Health. In fact, we just called you ad hoc and said, please join for this interesting meeting, and we want you to share your views and ask questions. And, we really congratulate her that she made time for this meeting. Thank you so much, Lakshmi, for joining. So basically, this meeting is being hosted by Mirror Health on Yugadi Day to celebrate both World Health Day as well as Yugadi. So you can ask any question which is kind of bothering you with respect to women's health, and we'll answer this question. And this recording is going to be on our website, so a lot of people can benefit on this.
Thank you, ma'am. Happy Ugadi, ma'am.
Thank you so much, Lakshmi. Yeah.
As of now, what are the problem I've got? I've asked you and I've got it.
This is something in the interest of so many women who are going to watch this as a recorded version, Lakshmi. So you want to ask something which would probably kind of be there, or there may be several women struggling with that question who have not kind of dare to ask it. So please feel free to ask any question and I'm ready to answer that. It could be pregnancy, non-pregnancy, post-delivery, anything that's concerning women's health. Yeah.
Ma'am, just only after the post-pregnancy, the woman's how they're supposed to take care, ma'am?
Okay.
With reference to the men, especially IVF, yes, ma'am.
Okay. So what you're trying to say is, like, you have a lady who's delivered, who's conceived through an IVF, and she's delivered. And now you want to ask me as to how this lady has to take care, correct?
Yes, ma'am. Yes, ma'am.
Yes. See, what you have to understand is an IVF per se will not add any extra, concern in this woman, but you have to understand that, most of these women who've conceived through IVF have risk factors which have complicated conception and pregnancy. And so, they kind of have these risk factors which need to be risk modulated even after delivery. So let me put it that way.